Hello, my name is Karin. I'm a licensed occupational therapist and a medical lymph therapist as well. I've been working with lymphedema patients in Sweden for about 25 years. Over the years, I have worked with compression as the main part of the treatment for lymphedema, primarily for arms and legs as well as for hands and feet. As we all know, there are certain areas on the hands and on the same place on the feet that are particularly challenging to treat with compression garment. Examples of these areas are the base of the fingers and the base of the toes. That's why I'm going to show you how to cut and adapt a Mobiderm pad so that it can be used under compression. It looks like this, and I call it the moose-shaped pad because in my opinion it resembles a moose with his antlers. Now I'm going to show you how to cut this pad for the dorsal side of a patient's foot. To create the pad, you will need to use a Mobiderm sheet. The version with small cubes is particularly well suited for cutting a moose-shaped pad. You will also need to use a transparent plastic sheet or tracing paper for making a template, a casual pencil to mark the edema of the patient's foot, a marker pen or a regular pen to transfer the shape to the sheets, a small sharp pair of scissors, kinesio-type tape with backing paper, and of course a patient and a little patient. The moose-shaped pad is made in 4 steps. Trace the area of the edema, make a template, transfer the Mobiderm sheets, reinforce the pad with tape to make it durable. Using a transparent sheet to make the template allows you to directly trace the edema from the patient's foot. This ensures that the pad will fit properly and target the affected area with precision. When a patient has a lymphedema in the foot, the area around the base of the toes is often hard to reach. Fluid tends to accumulate here, forming a small cushion-like swelling, even when using a compression stocking or a toe cap. This is exactly where the moose-shaped pad can be placed to help mobilize the edema and prevent skin folds from forming at the base of the toes. Start making the template by using a casual pencil. Face the edema in the following steps. Start between the first and second toe, honoring the shape of the edema, often along the first metatarsal. Identify the tarsal bones. Make a slope around them. Avoiding prevent any unwanted pressure there on the pad. Now you have the basic shape for the moose-shaped pad. Make sure you have enough material to reach between the toes and all the way around to the antler side of the foot. The pad should cover the forefoot sole as well. Transfer the traced shape to your transparent sheet. Here you can see the beginning of the template, which will be extended between the toes to the plantar side. Mark the holes for 2 toes. Let the template curl slightly laterally to follow the forefoot's natural slope. And make it bigger than you think it should be. Now cut out the template using scissors. And need some extra material extending to the plantar side. You refine this later once it's tested on the patients. Next, cut hole for the toes. Make sure they're not too large to start with. You now have the beginning of a template. Then try the template on the patient's foot to check the fit of the dorsum and of the toes. Make the adjustments need to be made, often enlarging the toe holes. Continue with the plantar side section, which needs to be sized so that it remains comfortable with a compression garment. Mark on the plantar side of the foot where the pad should be placed. It should usually cover the front sole of the foot, behind toes 2 to 4. Then try the pad on the patient's foot again. Trace the final shape onto the template. Then cut the shape. And now you have a complete template for the moose-shaped pad. Place it on the Mobiderm sheet. Try to position it in a way that allows you to use the sheet efficiently. For example, fitting several pads from one sheet if needed. Use a pen to trace the outline of the pad. Mark the location of the holes for the toes. They will be the eyes of the moose. Use a sharp pair of scissors to cut out the shape of the pad, following the outline you traced. To cap the toe holes, start by making a small notch in the center of each marked hole. Then enlarge them carefully. Now it's time to try the pad on the patient's foot. Check if it needs any adjustments to ensure it applies pressure on the right areas. Start with the dorsum, then check the size of the toe holes and make sure they feel comfortable and are not too small. Then check the fit on the plantar side. If necessary, mark the adjustments need to be made. The main function of the plantar section is to anchor it between the toes, preventing it from shifting or sliding up onto the dorsum. This size is usually appropriate for the plantar side of the foot. Trim any excess material. Once that's done, you have a finished moose shade pad, ready to use. However, in my experience, reinforcing the area between the toes adds extra durability. For that, I use a kinesio tape, since it's stretchable and has a backing paper. To do the reinforcement steps, ensure the pad is correctly oriented on the patient's foot. Use a pen to mark a cross on the top side of the pad. Place it on the work surface with that marked side facing up. Place the tape across the pad like a blindfold, covering the eyes of the moose. Then flip everything over so you can accurately trace the shape of the pad and define its position. Transfer the outline of the pad onto the tape's backing paper, leaving about half a centimeter of seam allowance on each side. Be folded around the pad. Mark the positioning of the tape on the pad itself for reference. Mark on the backing paper which side is supposed to point toward the toes. Cut the tape to shape, keeping the seam allowance on both sides. Before removing the backing paper, take a moment to double-check the fit and alignment of the tape against the pad. Gently pull to make a rip in the backing paper until it splits from the tape. Heel gradually, trying not to touch the adhesive side of the tape. Fold back about 2 centimeters of the backing paper and look for the pre-marked areas on the pad. Carefully place the pad onto the adhesive side of the tape. While holding the pad in place, slowly remove the rest of the backing paper, allowing the tape to stick along the pre-marked areas. Use the scissors to make small notches to fold the seam allowance. This is for reinforcing the curved edges and make them stay flat. Next, cut holes for the toes. Start by making a small notch in the center of the tape. Cut outward from the center for creating small tabs to fold over the edges. It's now important to use a sharp pointed pair of scissors. Clean, precise cuts will prevent irritation between the toes. Fold each tab back individually. The tabs should form like a star-like shape. Now that the moose-shaped pad is one-eyed, repeat the process for the second hole using the same steps. You might expect the tape to come off quickly, but these reinforcements are surprisingly durable even after months of regular use. Finally, place the pad on the patient's foot. Make sure with your patient that the fit is correct and comfortable, especially between the toes, and then check the plantar side as well. The moose-shaped pad is now complete and ready to be used with a compression stocking or a toe cap. It's important that the patient puts everything on themselves, then takes a walk to check that it feels comfortable and discreet. This will help patient compliance. The moose-shaped pad is primarily intended for use with flat mid compression stockings, but also works to wear with round mid. The most important thing is to inform the patient not to start by wearing it for a whole day immediately. The pad needs to be washed on a regular basis. It can be done by hand, but it can be machine washed as well. Some patients may require multiple pads and may wish to create them independently. In that case, you can provide them with their personal templates along with a Mobiderm sheet. Good luck with cutting customized Mobiderm pads like the moose-shaped pad for your patients. Thank you for your attention.